नमस्कार, वेलकम टू मेड इंडिया, एम्पावरिंग बेटर हेल्थ। मैं दिव्यांशी और आज मेरे साथ इस हेल्थ सेशन में जुड़े हैं डॉक्टर संजय शर्मा जी, podiatric surgeon and foot care expert. Today we will be talking about a special area of risk for diabetes patient, which is commonly called as diabetic foot. प्रश्न ये है कि ये इतना गहन चिंतन का विषय क्यों है? दुनिया भर में देखें तो हर 15 सेकंड पे कहीं ना कहीं a limb is cut off due to diabetic foot. Unfortunately, today the world is facing the risk of epidemic of diabetes and India is an epicenter and global capital for diabetes. डॉक्टर संजय, शुरुआत हम इसी से करते हैं। ये diabetic foot क्या है and how diabetes causes diabetic foot?
Thank you very much, Divyanshi, for this opportunity given to speak to the people through Medindia. And it's commendable in terms of people talking about diabetic foot in such forums, because earlier this was the most neglected topic, and as the foot is being neglected by the people also. So thank you very much for this. And to answer your question, so what is a diabetic foot? So let's just begin with something to understand about diabetes in a common language. So what happens in diabetes is the nutrition that is to be provided to the cells through the blood is not being provided to the cells. तो जहाँ पे आप एक blood vessels को आप एक road जैसा समझिए, तो वहाँ पे आप ट्रैफिक फ्लो हो रहा है, तो जहाँ पे उसको जाना है ट्रैफिक को वहाँ पे जाएगा, मगर वो रोड ब्लॉक है तो then the traffic will not go there, will go ahead. So similarly, if you look at the bloodstream itself, whatever you eat will get metabolized and then will be in the bloodstream, and those nutrients will, including glucose, will have to go to the cells for the cells to function. Like for example, I'm talking, I'm seeing, I'm moving my hands right now. For all of these, the cell millions of cells has to function. So in this context, what happens in diabetes is there is something called insulin that gets produced by our pancreas, and in a normal person, in a non-diabetic person, insulin acts like a key. Like the blood is flowing, and consider one cell as a room, and the room has a door, and the door has to be opened for the cell to take the nutrients in, take the glucose in for it to function. So for every cell, there needs an energy, and energy is nothing but glucose. This insulin is the key for it. So what happens in diabetes is, because in type 2 diabetes, which is like rampant in India, as you said, the quality of insulin is not so great. So वो चाबी जो है वो खुल नहीं पा रहा है, उस रूम को खोल नहीं पा रहा है, तो वो ग्लूकोज जो है वो ब्लड स्ट्रीम में ही है, अंदर नहीं जा पा रहा है. So the cells do not have that energy to function, and that is when it starts degenerating. So the highest amount of glucose is required for the nerve cells, the brain and the nerve cells, for it to function. So when this doesn't get significant amount of glucose, that is when it starts degenerating, and this is what is diabetic peripheral neuropathy. जो हर एक 50% डायबिटिक्स को ये डायबिटिक फेरिफेरल न्यूरोपैथी ये इंडियन सबकॉन्टिनेंट में होता है, almost 50%. So where there are symptoms like you cannot sense something on your feet, if something is touching, you will not be able to sense it. If you're walking, you will not know whether you're wearing a footwear or not wearing a footwear. These are all the advanced stages, but this is what you can see as a symptoms. And when the nerves gets degenerated, the nerves control everything. Like it controls sweating, it controls the blood flow, it controls the touch sensation. Everything is controlled by the nerves, and all these things also starts degenerating. So सिर्फ न्यूरोपैथी नहीं होता है, वास्कुलोपैथी होता है, जहाँ पे सर्कुलेशन कम होता है पाँव में, और न्यूरोपैथी के वजह से पाँव का शेप चेंज होता है, because it happens so gradually that people don't even observe it, but there is a change in the shape of the foot. So all these three things together, vasculopathy, intrinsic minus foot, that is what I'm saying as the shape change of the foot and neuropathy. All these three together is called as a diabetic foot. It is also called as diabetic foot syndrome because ये एक disease नहीं है, एक condition नहीं है, ये multiple conditions का एक syndrome है. So that is probably in a brief words what we call it as a diabetic foot.
सर क्या हर डायबिटिक पेशेंट को डायबिटिक फुट होने की संभावना हो सकती है?
Good question. So every diabetic patient is prone for a diabetic foot, is prone for neuropathy, vasculopathy, or changes in the foot, and even pre-diabetics have a chances. ऐसा नहीं है कि मुझे तो अभी 1 साल हुआ है डायबिटीज आके तो मुझे न्यूरोपैथी नहीं हो सकता है, वैसा नहीं होगा. So anyone has a chances of getting a diabetic foot, even pre-diabetics and long-term diabetics, uncontrolled diabetics also. India में, as I was telling earlier, there are about 74 million diabetics per se as an extrapolated figure, and 50% of them have a diabetic foot condition. And 19% of them have a diabetic foot ulcer per se. And whenever you have a diabetic foot ulcer, it takes about 12 to 52 weeks for one ulcer to heal. So it's like 3 महीने से 1 साल तक लगेगा average for one ulcer to heal. The studies have shown that then if you take the mean of it, it is about 28 weeks of what it takes for a one ulcer to heal. And there is about 140,000 registered amputations because of these ulcers that has been happening in India. As you told earlier, 20 seconds, there is one amputation globally because of diabetic foot, but in India, registered amputations, जैसे government hospital में होता है, register हो रहा है, तो वैसा it is about 140,000. But if I'm looking at non-registered, which we do at our own clinics, at the rural areas, non-government hospitals and all those things, it is almost about 14 lakh amputations that happen per annum due to diabetes. So one has to be careful. And all these ulcers, whatever I'm talking about, the 19% of the population having a diabetic foot ulcer, 14 lakh people undergoing an amputation can all be prevented if you meet your doctor, if you do not neglect your foot, if you do not neglect a simple thing, color change or something that happens in the foot, if you do not neglect it, these can be prevented.
सर आपने अभी बताया कि जो प्री डायबिटिक पेशेंट भी हैं, दे आर आल्सो प्रोन टू डायबिटिक फुट. अगर हम अर्ली सिम्टम्स और एडवांस सिम्टम्स की बात करें तो किस तरीके से लोग पहले ही अलार्म हो जाएं अगर वो सिम्टम्स को नोटिस कर रहे हैं?
So the challenge is the early the symptoms that we recognize today are not early symptoms. So the today's standard protocol that we have, at least in India, is that monofilament test बोलते हैं, जहाँ पे आप एक monofilament को लेके, if this is the foot kind of a thing, they touch it. There's a 10-gram monofilament, so they should be able to sense a 10-gram monofilament on their foot. This is the most easiest available test that has been available. But यहाँ पे 10 gram पे वो sense नहीं हो रहा है तो, which means that he has neuropathy. So it is like a diagnostic test. This is not a predictive test. So 10 gram पे नहीं हो रहा है तो it's already that he has neuropathy, and that is why he is unable to sense. So the early symptoms are something like you are unable to sense the hot or cold perception as your family member or friend is able to sense. जैसे आप, if you're walking in a temple or in a gurudwara or in a mosque or wherever you're walking barefooted, if you think that I'm strong because I can walk barefoot in that hot stone, on that hot stone, and the heat is not affecting me, then it's cause of concern. Don't wait till a doctor says that there is neuropathy. All these small things is a cause of concern. If you think that there are calluses, like hard skin in different parts of the foot, that is also a cause of concern. It is not because कि आपका skin rough and tough है तो इसलिए callus हो रहा है, उससे आपसे कुछ नहीं होगा, वैसा नहीं है. Callus is a precursor to an ulcer. कैलस से ही अल्सर होता है। तो क्या वो कैलस क्यों हो रहा है कि आपका पांव का शेप जो है वो थोड़ा चेंज हुआ है, और कैलस जहां पे हो रहा है वहां पे आपका पूरा बॉडी का भार जो है वहां पे आ रहा है. It is like a high pressure area, and that is what it is causing the callus. So if you do not look at those early symptoms, as I said, at least where you can look at it, then it's going to be challenged. Do not wait till doing a monofilament test where you cannot sense it. If you have a callus in the foot, if you see any color change in the foot, if you see any hair loss in the foot, like नी के नीचे जो हेयर्स होता है पाँव में, उसमें हेयर लॉस हो रहा है, तो these are all pretty early signs where you can go and meet your doctors, because most of the physicians are busy enough, they don't see कि हर एक डायबिटीज पेशेंट को चलो चलो पाँव दिखाओ, आपका हेयर लॉस हो रहा है क्या, वैसा नहीं देखेंगे, because they have their own priorities there. So if you see as a patient saying that any color change in the foot, nails, and especially the nails, these are also an early sign. If your nail is thickening, okay, that also needs, and if you're a diabetic, then that also needs to be addressed. Don't ignore ki I'm like 60 years old, the nail is thickening, I don't care. You don't have to go and get a pedicure done, but the nail thickening is also something to worry about as a predictive symptom for a diabetic foot.
सर बहुत जरूरी है, अगर आपने ये सारे सिम्टम्स देख लिया तो टू मीट योर डॉक्टर. सर अगर हम बात करें, आपने अभी बताया कि अर्ली सिम्टम्स और एडवांस सिम्टम्स किस तरीके से आपको नोटिस करना है. आफ्टर मीटिंग द डॉक्टर, किस तरीके से हम घर में अपने से वी कैन टेक केयर ऑफ द अर्ली सिम्टम्स एंड द एडवांस सिम्टम्स?
So couple of things. So we will also talk about the myths we were talking about on the diabetic footwear part of it, but that becomes pretty important here. So once you meet the doctor, once he says that there is neuropathy or there is no neuropathy, because see, as I told you, अभी जो डॉक्टर के पास भी जो है डायग्नोस्टिक टूल्स है, वो प्रिडिक्टिव नहीं कर सकता है. वो डायग्नोस्टिक है, आपका न्यूरोपैथी है नहीं है, वैस्कुलोपैथी है नहीं है, वो आपको बताएगा. वो वैस्कुलोपैथी हो गया है तो उसका मेडिकेशन वगैरह लेना पड़ेगा. मगर जो if you are a diabetic, and as we do not have a predictive tool as of today, like which is like very commonly available, there are predictive tools which are very expensive, available only in a high-end institutes or medical colleges kind of a thing, but normal diabetologists के clinics पे जो नहीं होता है, तो इसीलिए we will have to assume, as we know that 50% of them have some kind of a foot condition in diabetes, so we'll have to assume that you need to take care. I would say treat your feet as your face. That is my first mantra that I would say for everyone. If you're early morning, if you're getting up, looking at the mirror to see your face, how it is, you will also have to look at your feet. You will also have to look at your the bottom of your feet, the up, overall from the knee till then. Just look at your feet every day, every night. Like if you're looking at the mirror twice in a day, look at your feet twice in a day overall and see what is happening there. Is there dryness in the skin? Is there some discoloration? Is there some callus? तो क्या है पाँव में, वो सिर्फ देखिए, उसके that is the most important thing, and then we will say it shouldn't be ignored and all those things. But हमारा पेशेंट्स जो इतना फुट को इग्नोर कर देते हैं कि वो देखते भी नहीं है. वो पाँव धोते वक्त भी कहीं और देख के पाँव धो लेते हैं और आ जाते हैं. They don't even wipe the feet with the towel. So these are small things, wash your feet every day, wipe with the towel. When you're doing it, just observe your feet. That's the first thing that I would say as a symptom, as something one can do at home. Second thing is, वहां पे कुछ भी आपको in the sense, ये तो कल नहीं था अभी है, ये तो 1 month back नहीं था, अभी कुछ तो यहाँ पे दिख रहा है, तो इग्नोर मत कीजिए कि हाँ ये चलता रहेगा ऐसे ही है बोल के. तो उसको, आप डायबिटिक है तो पहले आपका डायबिटोलॉजिस्ट से या कोई भी फुट एंड एंकल सर्जन से, पोडियाट्रिस्ट से जाके दिखाइए कि मुझे ऐसा चेंजेस लग रहा है कि ये मुझे कंसर्न होने वाला बात है कि नहीं है. So this is something that I would say for every patient. Do not have to think about anything कि मुझे टेम्परेचर चेक करना है, वो करना है, कुछ भी नहीं. आप सिर्फ देखिए, वहां पे कुछ भी चेंजेस लगा तो आपका डायबिटोलॉजिस्ट या फुट सर्जन के पास जाके दिखाइए.
डेफिनेटली सर, और जिस तरीके से अगर हम जनरल पब्लिक की बात करें, वी इग्नोर आवर फुट, और जिस तरीके से हम फेस की देखभाल करते हैं, उसी तरीके से हमें अपनी फीट्स की भी देखभाल करनी है. सर, अगर हम बात करें, जो भी डायबिटिक पेशेंट है, बहुत ही लंबे समय से उन्हें डायबिटीज है, कौन से स्टेज में उन्हें बहुत ज्यादा अलार्म होना चाहिए कि वो डायबिटिक फीट प्रोन हो सकते हैं?
एज ए सेड, आपका न्यूरोपैथी ऑलरेडी एस्टैब्लिश्ड है, या वैस्कुलोपैथी एस्टैब्लिश्ड है, इन द सेंस ब्लड सर्कुलेशन के कम, उसके लिए दो डायग्नोस्टिक टेस्ट होता है. And usually we recommend three screening tests for all diabetes. Like जैसे हर 3 महीने में आपका HbA1c होता है, और they ask you to do a monitoring of your blood sugar glucometer से घर पे monitoring करना है, या आपका जो नॉर्मल ब्लड टेस्ट वगैरह जो साल में एक बार होता है, वैसे ही पाँव के लिए 3 टेस्ट साल में एक बार होना जरूरी है. आपका पाँव में कुछ सिम्टम है, ऑलरेडी डायबिटिक फुट आ चुका है, तो उसका फ्रीक्वेंसी कम होगा, 6 महीने में एक बार या 3 महीने में एक बार होगा, मगर साल में 3 टेस्ट होना जरूरी है. एक तो न्यूरोपैथी का टेस्ट होगा, दूसरा आपका ब्लड सर्कुलेशन का टेस्ट होगा, और तीसरा आपका पाँव का शेप कैसा है वो देखना पड़ेगा. सो व्हेनेवर ये टेस्ट जब किया है तो ये पॉजिटिव आया, तो मगर मैंने डॉक्टर ने बोला कि नहीं, आपको न्यूरोपैथी है ऑलरेडी, ये आपका मोनोफिलामेंट जो है, आप मोनोफिलामेंट के टच से आप वहां पे आप सेंसेशन नहीं हो पा रहा है, या वाइब्रेशन परसेप्शन के टच से आपको वाइब्रेशन पता नहीं लग रहा है पाँव में, या हॉट एंड कोल्ड परसेप्शन, गर्मी या ठंडाई, वो दोनों नहीं परसेप्शन नहीं हो रहा है पाँव में, तो दिस इज अ कॉज ऑफ कंसर्न. लाइक you are edging towards, or you have neuropathy, diabetic peripheral neuropathy. और दूसरा है कि ABI TBI, एंकल ब्रेकियल इंडेक्स और टो ब्रेकियल इंडेक्स बोलते हैं. ये जैसे आप BP लेते हैं, ब्लड प्रेशर लेते हैं हाथ में, वैसे ही एंकल में और टो में हम BP लेते हैं. और यहाँ का जो ब्लड प्रेशर है और एंकल का जो ब्लड प्रेशर है, आइडियली 1:1 होना चाहिए. उसका रेंज है, नॉर्मल रेंज है, बट आइडियली यहाँ पे भी 120/80 है, तो पाँव में भी, एंकल में भी 120/80 होना है, या सिस्टोलिक लिया तो यहाँ पे 120 है, तो वहां पे भी 120 होना है. अगर उसका रेंज है तो हम बोलते हैं कि 0.9 to 1.1 तक ठीक है रेशियो वगैरह. अगर वो रेशियो से कम है तो, या ज्यादा है तो, दोनों तरफ से आपका ज्यादा या कम है, तो तब भी आपका यू विल हैव टू बी वरीड अबाउट सेइंग दैट ओ मेरा ब्लड सर्कुलेशन यहाँ पे कुछ कम हो रहा है, तो इसको देखना पड़ेगा. दैट वुड लीड टू गैंग्रीन एंड अदर थिंग्स if the blood circulation is low. The third one is, ये कोई डायग्नोस्टिक टेस्ट नहीं चाहिए. यूजुअली एज आई सेड, प्लांटार प्रेशर स्कैन बोलते हैं उसको. जैसे आपको एक स्कैनर में चलने के लिए बोलते हैं, खड़ा रहने के लिए बोलते हैं, और वहां पे पता लगता है कि आपका बॉडी वेट कैसे डिस्ट्रीब्यूट हुआ है पाँव में, आपका पाँव का शेप चेंज हुआ है कि पहले जैसा ही है, वो सब पता लगेगा. उसके हिसाब से आपका पाँव के नीचे कोई कैलस है, या कोई पेन आ रहा है, या हील का पेन होगा, या 4 फुट का पेन होगा, ये सब आ रहा है, तो दैट इज समथिंग दैट यू नीड टू वरी अबाउट. एंड इफ देयर आर कैलसेस एंड कॉन्स इन द फुट.
So many times you have seen कि जो diabetic patients हैं, they end up with amputations. How it can be prevented, या फिर कोई और alternative methods भी हैं?
So amputation is the last resort. Nobody wants it. Not even the doctor, not even the patient. So we have a association called Indian Podiatric Association, which is also means I prevent amputation. So all the doctors who are with the Indian Podiatric Association, our motto is to prevent the amputation. So amputation is a very last resort. And there are enough other things to be done before we get to an amputation. Every tissue is important. ऐसा नहीं है कि हाँ ये छोटा उंगली है, ये इसको निकाल दिया तो कुछ नहीं होगा, आप निकाल के चलिए, वो बात नहीं होता है. एवरी टिश्यू इन द बॉडी हैज सम वर्क ऑफ इटसेल्फ. So it is important, and we try to prevent an amputation as much as possible, and that's our role. So whenever the easiest thing is to do an amputation. कोई गैंग्रीन हो गया है या इन्फेक्शन हो गया है पाँव में, तो easiest thing is अरे इसको amputate कर देते हैं. तो because it's easier for the doctor, बिकॉज एम्पुटेट करने के बाद रोज रोज का ड्रेसिंग, वो वो जो फाउल स्मेल होता है, इतना महीनों तक ड्रेसिंग करना पड़ता है वगैरह, वो सब नहीं होगा. एम्पुटेशन कर दिया तो 3 हफ्ते 4 हफ्ते में पूरा it will be completely healed. And so is with the patient. The patients today do not have the patience. So they would want it to heal faster, heal early, and save costs and everything. So he said, the easiest thing, the fastest thing is to do an amputation. But if you want to save the tissue, it will take time and money. रोज ड्रेसिंग आना पड़ेगा, हर हफ्ते ड्रेसिंग आना पड़ेगा, और उसको the doctor also will have to spend enough time every time, like when the patients come in. But it is possible to prevent amputations. The only things is when it is highly infected, or when there is absolutely no blood flow and has turned into a gangrene, then in those cases we will have to go ahead with an amputation, and we can always go ahead with a lower and lower amputation, not higher and higher, and this can be prevented. But if it is not so much of gangrenous or infected foot, there are enough advanced dressing methodologies like oxygen therapy. It could be silver therapy, WAC therapy. There are various things today now where we can prevent an amputation absolutely and make the patient walk on both the legs.
Diabetic foot wound care should be treated with special intent. Why it should be treated with special care?
Absolutely, it is not like any other wound. Any other wound would have healed in 7 days. The diabetic foot ulcers do not heal. It has its own mechanisms of why there is an oxygen supply is less, the angiosomes are less, the blood circulation is less, the nerve conduction there is lesser. So all this contributes into delaying the healing. Once the wound healing is delayed, then you are like welcoming all the infection in the world to come and attack the wound and become a diabetic foot infection. So it has to be treated very, very differently. Usually in our practice, if it is a general wound, कोई accident हो गया, trauma हो गया, गिर के आ गया, तो immediately हम hydrogen peroxide लेके उसको clean कर देते हैं, betadine लगा देते हैं, या कोई भी betadine ointment या यूसॉल वगैरह वो सारा यूज करते हैं. मगर वो सारा ग्लोबल स्टैंडर्ड्स के हिसाब से मना है डायबिटिक फुट में यूज करना. हाइड्रोजन पेरोक्साइड हो या बेटाडीन हो, दिस आर ऑल सेड टू बी साइटोटॉक्सिक. लाइक मुश्किल से ग्रैनुलेशन टिश्यू माने हील हो रहा है डायबिटिक फुट को, और उसके ऊपर आप इतना भारी सा इन सेंस इतना कॉन्सेंट्रेटेड हेवी मेडिसिन डाल दिया तो वो ग्रैनुलेशन टिश्यू नहीं बचेगा. So it has to be like a small kid. You'll have to treat it as a small kid. The small kid, when you're bathing a small baby, you will use shampoo, but you will use only some specific shampoo. When it goes to the ice, it will not burn. You will use oils, but it is specific oils, baby oil and things like that you would use. You cannot use general oil. So this has to be treated like a small baby with utmost care, and it will heal. It is not that it will never heal. It will heal. So, but care is required, and appropriate care is required.
So I'll talk about a common myth that is attached with diabetic foot. अगर किसी को diabetic foot detect होता है तो उनको अपना पैर पानी में नहीं, they should not soak their foot in water. How correct it is?
So diabetic foot is two things. One is if they do not have an ulcer, diabetic foot patient with a diabetic foot, like if he has vasculopathy or neuropathy or changes in the shape of the foot, he is absolutely free to do whatever he is doing with proper care, as being told, discussed in this like in this session now. Ulcer hai to, if there is an ulcer, then we say that, or most of the doctors say that, don't put it in water and all those things. So never it is said that don't put it in water. It is only said that don't keep it moist. मगर इंडिया में ऐसा है कि like when we were practicing outside of the country, the water is pretty clean enough, and then we can put it on the foot and everything. So India में water का contamination क्या होता है वो हमें पता नहीं है, तो इसीलिए we tend to कौन सा पानी डालेंगे, पानी डाल दिया तो बिस्लेरी डालेंगे या जो बाथरूम में जो पानी आता है वहाँ वो डालेंगे, वो हमें पता नहीं है. And most of the apartments these days also has the sewage treated water, so we do not know. So that is why it is normally saying things that don't put water, but a clean boiled and cooled water, or a mineral water, or any of these drinking water, I would say, is absolutely fine to put it on an ulcer. Small ulcers, I'm not saying कि हाँ हर एक ulcer में डालो, but it is absolutely fine to do it. Only thing is it should not be moist for a long time. उस पानी वहां पे रहना नहीं चाहिए. तो आप नहाने के बाद बाहर आ गया तो if you can just dry it, pat dry your wound, completely dry, and then do a dressing for it, it is absolutely fine. But वहां पे रहना नहीं चाहिए. The other myth, if I do not know if you have it in the next question, but I would want to cover it here, is there is something called diabetic footwear. हर एक दुकान में मिलता है diabetic footwear बोल के. That is absolutely my thing. That is absolutely you're cheating the people. There is nothing called as diabetic footwear. आपका जो black color का MCR footwear होता है या MCP's footwear होता है, that is only a soft footwear which is done so that when you walk it is softer. So आपका callus वगैरह है तो उससे आपका you don't feel the pain of it. So that is why it is being made, and it is good anyways. The softness is, I'm not saying it is bad, but it is not a diabetic footwear where it can cure diabetic foot ulcers, or it can cure diabetic neuropathy or diabetic foot symptoms. The softer footwear is good, but these MCR footwears which are sold across India, they come only for about 3 months. In a sense, उनका shelf life है पहनने के बाद इंडिया के temperatures में वो 3-4 महीने सिर्फ आता है. After that softness goes and it becomes hard. But in India, our people have a tendency to wear a footwear until their foot touches the ground. इतना घिस जाना चाहिए footwear कि आपका foot धरती को छूने के बाद ही वो footwear को आप discard करेंगे. So that then it is of no use. So if you are able to change your footwear every 3 to 4 months, then use an MCR footwear. Otherwise, do not use an MCR footwear. There is nothing called as a diabetic footwear. So that's the second myth I would want to say.
Thank you, Dr. Sharma, for busting these myths, which people commonly have. If a patient is detected with diabetes, शुरुआत से उन्हें क्या precautions लेना चाहिए ताकि they do not ending with diabetic foot?
Primarily ensure that, as I said earlier also, just look at your feet every day. Get your blood test done. Include vitamin D and vitamin B12 in the blood test. If there is a deficiency in either of them, ensure that you supplement it so that you don't get into vitamin B12 or vitamin B deficiencies that might lead to diabetic neuropathy or diabetic vasculopathy. Vasculopathy can also occur due to blockages in your arteries. So and healthy lifestyle, as I said, whatever is the diabetic के लिए जो कुछ भी बोलते हैं कि आप एक्सरसाइज करो, वॉक करो, HbA1c कम रखो, वो सारा आपको यहाँ पे भी फॉलो करना चाहिए. वो सब के बाद आपको पाँव को देखना चाहिए to prevent things and ensure that your vitamin scores are pretty good. It is not depleted. So that's a very simple thing to take care of your foot, and you wear an appropriate footwear. Most of the injuries that we see today in diabetes is because ये घाव अपने आप नहीं हो जाता है. There is use an appropriate footwear in the sense वो it should not be a footwear where it is pressing your toes like this. वो जो tip-toed shoes होता है वो मत पहनिए. Broad toe box वाला high heel नहीं, like all, it's not like a flat like a barefoot kind of a thing. It is not even a flip flop या हवाई चप्पल्स नहीं पहनना चाहिए. मगर जो रेगुलर फुटवेयर आता है अच्छे से फुटवेयर उस पे थोड़ा इन्वेस्ट कीजिए. Like whatever you are investing on your hair, on your clothes or whatever, you also invest some amount on getting a right shoes or getting a right chappals, so that we can save your foot. Like 500,000 रुपए का फुटवेयर खरीदने से आपका पांव ही, if you can save your foot from amputation, then it is worth spending about $1,000 on a right footwear.
Thank you so much, sir, for joining us and for talking to us on diabetic foot. बहुत सारे ऐसे confusions रहते हैं लोगों को और शायद वो अपना ध्यान भी नहीं देते diabetic food के लिए. आपने उन सभी queries को clear किया. Thank you so much and we wish you good health.
Thank you very much for this opportunity once again. I hope somebody listens to this talk and then goes and meets a doctor and then prevents an amputation. Thank you very much.